Welcome back. PTSD is a familiar term and shortened for post-traumatic stress disorder. We've all heard those words, but are the people with it actually getting the help they need? Joining us this morning is psychiatrist Dr. Kristina Kennedy with Baptist Health Behavioral Health Clinic. Dr. Kristina, thank you so much for being here.
Hi, yeah.
So let's start with an easy question. What exactly is PTSD?
Yeah, so the way I like to explain it is if you have a trauma or a stressor that's actively going on, your body's going to go into like fight or flight mode, essentially. PTSD is basically when the trauma or stressor is gone and your body's still going into fight or flight mode even after the fact.
Can you have PTSD and not know that you have it?
Yeah, absolutely. So if you can have the symptoms and just not really know what's going on. And so I think we're going to go over the symptoms next.
Yes, yes.
And the symptoms are often, different people can have different symptoms, but the most common symptoms are going to be hyperarousal and hypervigilance, so feeling like you're just constantly on edge, just every single thing could set you off, avoiding things that are associated with the trauma or the event, feeling like you're having recurrent flashbacks or intrusive thoughts of the trauma, and then often nightmares and mood disturbances as well, so depression, trouble sleeping, things like that.
Does all trauma cause PTSD, and who is at most at risk?
No, so not everybody who experiences trauma will develop PTSD, but everybody who does experience trauma has the potential to. Certainly people that have very significant trauma, so life-threatening traumas or sexual abuse is often associated with the development of PTSD. If you're having a trauma that goes on for a longer period of time, you're at a higher risk, but really anybody who experiences trauma can.
What about treatment options?
So the best treatment option for PTSD is going to be, there's specific therapies that are developed for the treatment, focused on going through the trauma and working through that. However, that's very difficult because often you're reliving those experiences. And so usually we'll use a combination of medications and therapy for treatment. Medication to kind of help you get through the therapy mostly.
Well, Dr. Kennedy, thank you for being here, and thank you for being so easy to talk to. I'm going to come by and maybe make you my doctor. I don't know.
Yeah, absolutely.
Well, if you want to contact Dr. Kennedy, you can do so by contacting Baptist Health by going to baptisthealth-.com or calling the Baptist Health line at 188-BAPTIST.